Hey, Communications 101 from Liberty University. Uh, this is Will Wyatt. I'm coming to you from Richmond, Virginia, the 804. I live here with my amazing wife, Sabrina, and we have one daughter, Macy. She's going to be 2 in October. The big theme for her birthday party is going to be to the zoo. We are extremely excited about the party and her turning 2. She's our first child, so you know all the good stuff that goes along with that. As far as hobbies, interests go, with our free time, the thing that I like to do the best is go fishing. It doesn't happen nearly as much as we'd like to, but the wife loves to fish, the whippersnapper likes fishing, and it's just the best thing we can do. We also like to go walks and do the other things that you have to do as part of life, go grocery shopping and do our hot dates to Sam's Club, get a slice of pizza or something and knock out the groceries and buy new paper towels and toilet paper, all the stuff you have to do in life. Right now, I'm pursuing my RN to BSN. I currently work as an RN at a level 1 PICU. So I work with anyone from basically newborns to, we go all the way up to about 21-year-olds for our special populations that have some type of chronic thing that might be a pediatric disease. But for the most part, it's like a lot of the littler patients. I've also worked on the adult critical care side. I've always worked in either critical care or resuscitation medicine. This is where my passion's been. Before I was a nurse, I was a paramedic. I was a paramedic for well over a decade, I guess about 15 years. And then I decided to go to nursing school just to kind of further my degree, my education, and provided a different type of care to patients. So I think in my heart I'll always be a paramedic, and that's just probably the job that I've loved the most. But being an RN is a whole different challenge that I've thoroughly enjoyed for the past few years. As far as plans go, if you would have asked me 10 years ago, would I be a nurse? I'd be like, you're crazy. Absolutely not. So I'm not sure where I'm going to go right now. My plan is to get my BSN, and I'll probably do some type of higher degree, whether that's getting my master's or doctorate and going back and teaching, or doing like a CRNA, like a nurse anesthetist or something like that. But this is definitely not the end for me. This is just the beginning, and maybe kind of towards the beginning, middle. But I definitely want to do something. I'm just not sure what it is. Just got to have faith and keep on going. What do I want to learn from this class? I think I definitely am looking forward to this class. I think it's going to be fun. I think it's going to be nice to kind of get something that I can apply to not only work and school, but also to life. You know, I think communications is one of those things that no matter who you are, you can always do it a little bit better. There's something you can learn and move forward with. Just in trying to make these little videos, I realize I say and a lot when I get nervous, or I'll start talking real fast sometimes. So I don't know. I'm very excited to see what I can learn and move forward with this. So this brings me to my story about a life-changing event. So the first thing I thought was, I'm going to talk about the birth of my daughter, Macy. I think every parent would love to talk about the birth of their child. But I feel like it's kind of like a hackneyed thing. So I started thinking about it, and I was like, well, I could talk about getting married or proposing or something like that. And I was like, well, let's talk about the birth and babies, but go back a little bit. So I'm going to tell you about the first baby I ever delivered in the pre-hospital environment. So I'll take you back to January 16th, 2002. I was riding as a volunteer EMT. I wasn't even a paramedic yet. I was just a little volunteer EMT. 110-hour class to get your EMT. And I was riding on an ambulance. It's a cold January night. It's about probably 11:30 at night. And we get called for the imminent birth. Well, imminent birth, that sounds pretty intense, you know? So usually it's just someone that's starting to have some Braxton Hicks or some false contractions, and there's not much to it. But imminent birth, it's just like, this could happen. So the county that I was volunteering in also have a career fire service with a few ambulances. So the career engine actually beat us on scene by a couple of minutes, and there was an ALS provider or a paramedic that was on scene on the engine, and they had made the decision to get the patient out of the house into the ambulance because the house was in kind of disarray. It was just a dirty house. So we get her out to the truck, and the paramedic looks over at me, and his name was Cecil, and he goes, "Will, women have been birthing babies for years. Just stay calm and don't drop the baby." Sounds simple. Okay, don't drop the baby. Woman been doing this for years. I was like, okay, I got this, you know. Once again, 16 years old, just kind of getting my grounds to me. And so we start bumping up the road. Then the lady looks over at us like, I need to push. I need to poop. It's like, that's never a good sign. So tell the driver to pull over. and the paramedic turns around and put on his sterile gloves to receive the baby that was already starting to kind of come out. You can see the head and is starting to push. And she's like, I need to push, I need to push. So Cecil turns around and is putting on his gloves. Well, at this time, she's like, it's going, it's happening. Whoosh, out comes the baby. Well, me, Cecil just told me don't drop the baby. I reach down, swoop up underneath of it, grab the kid before it hits the stretcher, and pick up the little baby boy. First time I'd ever held a newborn like that. And we dry it off. Baby starts breathing on its own, crying, lets out that whelp. You just feel a big sigh of relief come over you. Magical, magical time and moment. Wasn't my child. It was the first time I'd ever seen a baby born, and it changed me. You know, what I took away from that experience was one, every baby's a miracle, and number two, don't drop the baby. All right. In life, we're gonna face a lot of things that are really complicated and really hard. At the end of the day, we just gotta slow down, woosah, take a deep breath, and appreciate the situation for what it is. So that's my story. I hope you guys have a phenomenal class. I look forward to moving forward in this class with everyone.